Medicare Advantage plans all over the nation are seeing benefits reduce in 2025 thanks to the impact of the Inflation Reduction Act. But what benefits can you be looking out for on your particular plan to see if they're pulling back in 2025? In this video, I'm going to go over exactly what we're seeing all over the nation on the most common benefits that are being reduced on Medicare Advantage plans for 2025. My name is Christian Brindle. I'm a Medicare health plan expert and specialist. I run the insurance agency called Christian Brindle Insurance Services, also known as Everything Senior Insurance. And in this video, we're going to jump right into these 5 common benefits that are being pulled back. So without further ado, let's jump in. Number 1 most common benefit that we're seeing reduced on Medicare Advantage plans in many areas all over the country is the Medicare Part B reimbursement or give back benefit. I'll explain what this is if you're not familiar. It's been relatively a common thing in certain areas that there were plans available that would reimburse a portion of your Medicare Part B premium. Over the past 3 to 5 years, this has become more and more of a popular benefit to be included on your particular Medicare Advantage plan. What this means is everybody on Medicare has a premium that they pay for Medicare Part B. Most people don't pay any premium for Medicare Part A. That's usually paid for throughout your working life out of your paychecks for FICA taxes. However, Medicare Part B does have a monthly premium that everybody on Medicare does pay. For most individuals, this is coming automatically out of your Social Security check. A majority of people don't even realize that this is coming out, but it is. And for most people in 2024, that premium was $174.70 a month. It is currently projected, without the final numbers being available, to go up to $185 in 2025. Why am I telling you all this? Why does this matter? Well, there were certain Medicare Advantage plans available, and there still are for 2025, that will reduce your Medicare Part B premium for you. What I mean by reduce is they call it a give back. They will actually make a payment on your behalf, and they'll work with Social Security to essentially lower the amount of your Medicare Part B premium that is charged to you on a month-to-month basis. Now, this is not a plan that's available in every area or every state or every market by any means, but there were plenty of markets that had plans that offered this benefit available over the past couple of years. Some areas it might have been $10, $20 a month. Some areas it might have been $50, $60 a month. And some areas it might have been almost, if not your entire Medicare Part B premium. We are seeing a slew of different plans all over the country reduce these benefits in 2025 or completely stop offering them altogether. Okay, again, my agency is licensed in over 45 states, so we deal with a whole bunch of different plans in a whole bunch of different markets, and this is something we're seeing in a lot of areas going bye-bye for 2025. Benefit number 2 we're seeing get slashed on a lot of plans in 2025 is the dental benefits. Now, again, none of these benefits are being slashed everywhere, and none of these benefits are being slashed all at the same time on every plan. But what we are seeing as a result of the Inflation Reduction Act, if you're not familiar with what that's talking about, make sure to check out our Inflation Reduction Act videos on this channel, and they can actually go over with you what is entailing. But in short, in layman's terms, the Inflation Reduction Act is causing a mandatory $2,000 maximum out-of-pocket cap for all Medicare plans, whether it be Advantage plans or standalone prescription drug plans, to essentially require a $2,000 cap on every plan, meaning that they have to pick up 100% of the prescription drug bill once prescription costs have reached $2,000 for a single individual member. This is causing insurance companies in 2025 to pay much more for prescriptions and claims than they've ever paid before. The domino effect of this is other benefits are starting to suffer, and they're being cut as a result. Okay, so dental benefits, we're seeing a lot of plans in a lot of different places cut their dental benefits. Some are reducing their maximum payout limit. Maybe there's a plan in a market that pays for $1,000, $1,500, $2,000 of comprehensive dental work, meaning it might have paid for things like crowns, bridges, root canals, things like that. Maybe they're not paying for as many things. Maybe they're not paying for things as often. Maybe they're reducing their maximum payout limit for a year. Maybe they're going from $2,000 to $1,500. Maybe they're going from $1,500 they'll pay out a year down to $1,000. Maybe they're just eradicating the dental benefit all together and doing just preventative dental, if that. We're seeing a lot of these things in a lot of different places, far and wide. So make sure to check your specific plan and see if the dental is intact or if it's gone down for 2025. Benefit number 3 is the over-the-counter item benefit. A slew of different plans were providing, okay? So the over-the-counter item benefit essentially is a benefit that will allow you an allowance. Some plans might offer it monthly, some plans might offer it quarterly, some plans might not offer it at all, but the plans that were offering it, and the majority, what we saw in most markets was essentially giving you an allowance that you could use to buy over-the-counter items that are not prescriptions, right? Think about things like aspirin, ibuprofen, fish oil, Band-Aids, vitamins, toothpaste, dental floss, things like that. And the way these benefits would work is they would either have you order it online through the mail and they'd ship these items to you, or with select partnered locations and stores and pharmacies, you could go in and swipe your card and it would be paid for right there on the spot, and you could walk out with those items as long as it was in your budget, okay? We're not seeing these benefits necessarily go away, but we're seeing some plans that were offering the over-the-counter item benefits take it away for 2025, and some plans that were offering the over-the-counter item benefits reduce the allowance that they were providing previously in 2025. So the over-the-counter item benefits on a lot of plans in a lot of places are suffering next year. Benefit number 4 is RX coverage, meaning prescription drug coverage, okay? Now, anytime you have a mandatory cap put into place at the $2,000 cap for the Inflation Reduction Act starting in January 2025, you're going to see the plans essentially start putting deductibles on their coverages, okay? So what this means is if you have a deductible, that amount is usually the amount that you'll have to pay 100% of the cost of your prescriptions, either on certain prescriptions or all prescriptions, out of pocket before the plan will help pay for anything. In 2025, you're seeing a maximum deductible that's allowed to be charged on your plan of $590. This is as high as it's ever been before. We're also seeing more and more plans have deductibles slapped onto their prescription drug plans. Maybe it's not the full $590, but plans that did not have any deductibles in 2024 are now adding $200, $300, $400, and some, yes, $590 deductibles on your prescription drug plans, which means in January you'll have to satisfy that deductible if you take any kind of expensive brand name medications. Not a nice surprise for the beginning of the year. And last but not least, benefit number 5 that we're seeing reduce in 2025 is medical benefits. That's right. Copays are going up on a lot of different plans. Maybe you had a $10 or $20 specialist copay that is turning into a $40 to $50 copay. Maybe you had a maximum out of pocket that was $4,500, $5,000. Maybe that's going up to $6,000 or $6,500 for 2025. So we're seeing a lot of plans increase their medical cost sharing for their members and increasing their maximum out of pockets, meaning that when you use the plan, you're going to have more out of pocket for those certain items, okay? So what we're seeing is some plans are choosing to slice and dice the medical coverage. This is nothing that we love to see, but this is something that we're seeing. Which of these 5 benefit reductions do you feel like is the most detrimental on a Medicare Advantage plan? Let us know down in the comments of this video. We'd love to have a dialogue with you. We'd love to kind of get your feedbacks on it. Certainly, we don't like to see these benefits be reduced. It's just a nature of the beast, however. It is a domino effect of the insurance companies having to pay more for their prescription drug claims. That doesn't mean that you have to be helpless, though. My organization is licensed in 45 states. We have amazing team members, and we can help you this open enrollment period with your plan options, right? Just because a plan is reducing a benefit doesn't mean that there's not another plan out there that still is strong in that area that you care about. This is the year of any year to really compare your plan and make sure that it is the best one in 2025. My team is world class. We are fantastic, and we eat, sleep, and we breathe Medicare. So we're good at diagnosing and finding out if the plan you're on is the best one for you. Call us today for a no-cost, no-obligation consultation at 801-255-5340. Again, 801-255-5340. You can also find that number down in the description of this video. Call us today. let us take a look at your plan for you and see if you're impacted by these changes. Again, we're seeing them far and wide all over the country. We highly recommend having a consultation done and having a comparison done. And again, let us know your feedback. What do you think about these changes? Is this something that's concerning to you? Let us know. We want to have a dialogue with you. If you enjoyed this video, you found it educational, insightful, and bringing awareness to these problems and these plan reductions that we're seeing, do us a favor and smash the like button for the YouTube algorithm. We help so many people like you on Medicare, but we can help way more if people find the video easier due to your support. So thank you so much, everybody. Make sure to subscribe. We'll see you on the next one, and happy Medicare, everybody.